another episode of Health Chats with Marion, where we discuss all things sexual and reproductive health. I'm your girl, Marion McIntyre. Thank you so much for joining me here today. And I hope you got a chance to watch the last video where we looked at 10 things that you need to know, 10 questions that you need to ask when you're deciding on a contraceptive method. So what we'll be doing moving forward for the next set of videos is to look at individual contraceptive methods, delving a little bit deeper into the benefits of each, how it works, side effects, etc. All in an aim of helping persons to make more informed choices when it comes on to contraceptives. So today we're going to be looking at OCPs. That's oral contraceptive pills. That's probably the most common contraceptive, and I'll be sharing a little bit more information about it today. So we have primarily two types of OCPs. One contains estrogen or estrogen, depending on how you want to pronounce it, potato, and it also contains progestin. Now these are hormones that are naturally found in the body. However, there's another pill called the mini pill. That pill does not have both of these hormones. It only contains progestin. So it's a milder pill, and it's usually recommended for certain types of persons who may not be able to take the pill that contains both hormones. Your doctor will be better able to determine with you which one of the pills is a better choice. So we'll be looking primarily at the more common one, which is the pill that contains both hormones. Alright, so exactly how does this pill work? Well, it has three modes of operation. The first being that it reduces the likelihood or inhibits ovulation. Now, ovulation is when you have an egg being released from your ovaries, and that happens every month to a person, more or less, to persons who are not taking any sort of contraceptives, and this is just a part of your natural menstrual cycle. So it inhibits that. So if you're not producing an egg, or an egg is not being released rather, the likelihood of getting pregnant has drastically reduced. Secondly, it thins the wall of the uterus or the womb, which makes it very difficult for an egg, a fertilized egg, to be implanted. So you won't have a pregnancy developing because of OCPs. And thirdly, it thickens the cervical mucus. So where at the entrance of the cervix, that you'll have the mucus being thickened so that sperm will not be able to pass through to go into the womb. So using these three mechanisms, you can see why it is very unlikely for a pregnancy to happen. So usually once a person is taking these pills and taking it how they're supposed to, on time each day, and you're very disciplined, definitely this is a mechanism or a method that can work well for you. Now there's some additional benefits to using OCPs. Some of the pills will actually promote these other benefits. So for example, persons will actually see a reduction in their acne if they're taking OCPs. So we have specific brands such as Yaz, or there are several others that actually help persons who are dealing with acne. Secondly, it helps you to deal with PMS. So if you're someone who tends to get really emotional and you have these things happening to you physically and emotionally before your period, the pill tends to help to regularize that and kind of calm things down for you a little bit. Thirdly, it also helps persons who have very heavy periods. So if you are someone with endometriosis, or you just tend to have very heavy periods, painful periods, the OCPs can help you to lessen the pain and the discomfort associated with your periods. There are certain other benefits to OCPs as well. Some persons find that when they're on OCP, it does not make them gain weight. Well, unfortunately, there are some other persons who do increase in weight and their appetite, but for some persons, that's an additional benefit. It tends to help them with weight loss, or they find that they're not gaining weight while they're using that particular method. All right, so you have two primary types of OCPs in terms of how they are presented. So they're in a little blister pack. You can have the 21-day or you can have the 28-day pills. The 21 days are active pills, 21 active pills. So these are pills that contain the hormones in them that are actually giving you protection. And at the end of the 21st day, you break. You stop taking pills for 7 days. This allows your body to actually, you actually have a period, right? You have breakthrough bleeding at that time. However, the 28-day pill set has 21 active pills, and the 7 other pills, tend to be maybe iron tablets or just pills that help you to continue to take them at the same time each day, but they don't have the active ingredients in them. So with the 21 day, you will take a break for 7 days, but with the 28-day blister pack, you take no breaks. So when you finish the 28th pill, you start right back the next day with a pill number 1 from a next pack. All right. So there's no break with the 28 pill set. So those are the primary ones. I've heard of pill sets where you have 91 pills, but I don't believe those are available in Jamaica, maybe in the US or some other countries. So I'll speak primarily to the ones that I am familiar with. All right. It can cause nausea. So we normally recommend that if persons are going to be taking pills, they take it with food or some sort of liquid, because you don't want to be getting nauseous and vomiting the pill out, because then you run the risk of not having enough of the hormones in your body to be actively giving you protection, and then you run the risk of becoming pregnant or leaving yourself exposed to becoming pregnant. So to prevent the likelihood of the nausea, it's recommended that you take it with food or some sort of liquid to help you to digest it a little better. You take it on the first day of your period. However, if you take it, that's the ideal situation, right? However, you can take it at any other time. But when you take it outside of your period, you have to use another means of protection for 7 days, because that's when you will be able to be sure that you are now protected and can only depend on the OCP. But once you take that pill outside of the first day or the first few days of your period, you have to use another method for 7 days to ensure that you're protected. Now, if you recently had a baby, like me, I had a baby in December, it's usually not recommended that you take OCPs, because it can affect your breast milk production. And if you're somebody who wants to ensure that you're doing exclusive breastfeeding or breastfeeding as much as you can, you don't want to run the risk of that affecting your milk supply. But if you do decide that the OCPs are the way that you want to go, that's the method that you want to use, it's recommended that you wait at least 4 weeks after you've had your baby, after you've given birth, to start taking those medications. The choice is really ultimately yours. Now, there are some persons who should never take OCPs. The doctor will not give it to you, ideally, would not recommend it to you. And these are persons who have a history of blood clots, a history of heart attacks, and a history of strokes. So if you have that situation, you have that in your medical history, the OCP is not for you. All right? And you can have further discussion with your doctor about which method would be more ideal. Now, just as with every other kind of contraceptive, there are side effects to the OCP. So we're going to go through those real quickly. The first one, definitely, I'd mentioned it before, is a nausea, right? There's a strong likelihood of you developing nausea when you take these pills. And some persons have upset stomach once they're taking the pill. Sometimes it only happens during the first few days. Once you've started this type of treatment, and your body tends to become more acclimatized to it, so the likelihood of that lessens. But there are some persons who, no matter how long they take the OCPs, they'll always be feeling nauseous and icky and wanting to throw up. So for those persons, you tend to want to try different types, because no two OCPs are identical. You may take to one and not work well with another one, so it's really trial and error to find one that works for you. You can also have diarrhea, constipation, weight gain or weight loss, as I mentioned earlier about some persons actually losing weight while on the OCPs. You may have unusual hair growth, hair popping up in some very strange places that you've never had it before. That could be one possible side effect. Spotting in between periods, that's a very common side effect. In fact, it's a very common side effect for almost all contraceptives, especially during the first few months of use. Again, sometimes it takes the body a while to get acclimatized to this new level of the hormones in the body, and usually after a while it tends to regularize itself. You may have changes with your vaginal discharge. Some persons may notice that they have more of a white vaginal discharge. Again, this does not mean that anything is wrong. It's just a side effect or an unusual reaction to the OCPs. Some people tend to also have symptoms that mimic pregnancy. So you're taking the OCPs and you start to have the breast tenderness and the bloating, and you're wondering what's going on. Again, remember, these are hormones that are also a part of your regular menstrual cycle. So sometimes your body will respond to the pill in this way, but again, for many persons, these symptoms tend to go away after a few months of use. All right, no, the pill absolutely does not protect you from STIs and HIV. I know everybody like, duh, we know this. But I have to say that because, again, if you are someone who's in a situation where you may be having several partners, or you're having casual sex, or there's just a high risk situation going on for infections, you really want to be using the oral contraceptive pill in conjunction with condoms, because that's the only way that you'll have pregnancy protection as well as protection from STIs and HIV. Just gonna ensure that I put that plug in there. All right, so the pills are available at any pharmacy across the island. And additionally, as I mentioned in the last video, the public health clinics, most of them from type 3s up, you can join the family planning clinic there and you can have access to the OCPs that they offer. So if you want to get your pills free, that's one way that you can get it, and otherwise you can just go to a pharmacy and buy your pill. You can also ask for recommendations. Your doctor might be able to decide, help you to decide which one will be more ideal for you, because as I mentioned, there's several types of pills and you may react a particular way to one, but another one, it's just perfect. You have no issues, you take it and you're fine. Now, I didn't mention earlier, if you are taking OCPs, you have to be very disciplined. Very, very disciplined, because you need to take the pill at the same time every single day. The reason for that is if you take it at the same time every single day, you won't have any dips in the level of progestin and estrogen that is in your blood while you're taking the OCPs, because that's ideally what you want. You don't want to have any sort of dips and spikes. You want it to just be at the same level throughout the entire time that you're on this particular method, so that you're constantly protected. So the mechanisms that I told you that this pill works by to ensure that you're protected, that will continue once you take it at the same time every day. Now, if you miss a pill, say you forget to take the pill today, and okay, you don't remember until tomorrow, fine, just continue taking the pill. Don't double up. Take the pill as you would normally take it and continue. However, every pill tends to be unique when it comes down to the instructions about what to do when that happens. So it's very important for you to read the leaflet that is in your OCP box, because then when it comes down to that specific pill, they'll tell you what to do if you miss one or two pills. Sometimes if you miss several pills, they may tell you to, all right, just throw that pack away and start a new pack. And get a pregnancy test. There are several instructions that they may give you, so you need to pay keen attention to that, and that information is inside the box. Also, if you're over the age of 35 and you smoke, the OCP is not for you, because it heightens the likelihood of adverse reactions such as hypertension, stroke, blood clots. So it's usually not recommended for persons who are smokers and they're in, over the age of 35. However, if you're over 35 and you don't smoke, you don't have a history of smoking, you can take the OCP until menopause. All right, so there are many other things that could be said about OCPs. However, usually once you talk to a pharmacist, if you're at the pharmacy buying the pill, or you're at your OBGYN, or you're at the nurse at the clinic getting your family planning counseling, there's more information that they'll share about it, and they'll ask you some things about to just ensure that the likelihood is that you will be taking this medication as you should. If you are very young, for example, if you're a teenager, they may not recommend this to you because, I mean, come on, teenagers, you're really not going to remember to take this pill every day, right? Not bashing teens now, I'm just saying, I remember when I was a teen, I wouldn't remember that. So they tend not to recommend that to teens. For teenagers, we tend to recommend the type that you can just get it inserted and you don't have to worry about it for a while, so it gives longer protection. However, if you are very disciplined, whether you're a teenager or an older woman, if you're very disciplined and you think that this one is for you, you can you can have that conversation with your doctor, your nurse, the pharmacist, to get some more information about particular brands that you think could work well for you. All right, so that's it on OCPs today. If you have any questions, please send out the question in the comment section. If you have any other information about it that you want to share, any experience that you've had with it. I know some persons may say that they've had really bad experiences with OCPs. Some, not an issue. They take it and they're good to go. So I'd love to hear from you what your experience has been taking oral contraceptive pills, because remember, we are all sharing information with each other to empower each other, to help us to make informed choices about our sexual and reproductive health. And that's it for today about OCPs. Look, I hope that you'll stick around for the next set of videos when we'll look at other types of contraceptives and do a deep dive into those methods and continue this conversation. Again, if you like this kind of content, I hope that you will not hesitate to like, subscribe, and click the bell so that when other videos come, you'll be notified and you'll be able to view them. Thank you so much, and looking forward to seeing you in the next video.